स्टार्ट करने बोल दो है ना।
माइक ऑन करना पड़ेगा ना और ज्वाइन को
अभी तो ये शेयर इसका है ना।
ये यूट्यूब लिंक है क्या? गूगल मीट में कौन कौन है?
किधर से बोलेंगे? यहीं से बोलेंगे ना, यहीं से।
14 लोग हैं।
हमारे टीचर्स ज्वाइन नहीं किए, वो लोग यहाँ से ज्वाइन कर सकते। स्टूडेंट्स का भी एक बार शो दिखा दो, ये फोटोज लेना है, इसके फोटोज भी लेना है विथ वो ये आई क्या होता है कैमरा लोकेशन का। ऑन कर दो, ऑन कर दो। गुड आफ्टरनून सर, वैजन सर।
Hello, good evening.
Nice to see you.
How are you?
How are you, sir?
I'm fine. How are you?
I am fine, sir.
You are celebrating Ayurveda Day, eh?
Yes.
Okay.
This is our event from our department side.
Okay. Thank you. Today's speaker is
Professor Shanta Kumari, madam.
Shantala Kumari, ma'am. Okay.
Not Shantala, Shanta Kumari, ma'am. From
Shanta Kumari.
Shanta.
Okay.
Thiruvananthapuram. Yes.
Okay.
We will start shortly.
Yes, you please.
Good afternoon, madam. Shanta. How are you? Shanta Kumari, madam, how are you?
I am fine.
Okay. Thank you so much for joining.
Everybody is raised.
Resource person. We'll start the program. Ravi, can you just start the program? Yes.
Okay, ma'am. Good afternoon, respected dignitaries, PG PhD scholars, and any other fellow participants to this webinar. On the occasion of the 10th Ayurveda Day, by Department of Salakitana and National Institute of Ayurveda, Jaipur. The topic of today's webinar is clinical experience in management of retinal disorders and Ayurveda perspective. Let's start the session with Retinal. I would like to welcome Dr. Ravish for this.
Can you start the conversation?
तर्यादिदेवं सुरासुरैः वन्दितपादपद्मं लोके जरा भयमृत्युनाशं दातारीशं विविधौषधीनाम्
There's echo.
It gives us immense pleasure to extend a warm and heartfelt welcome to Professor Dr. P.K. Shantakumari Ma'am, Chief Physician and Managing Director, MADA Group of Ayurveda Hospitals in Kerala.
Now I would like to welcome Professor Dr. Shamsa Fiaz ma'am to put some insights into today's webinar.
Thank you, Dr. Sharanya.
Insight is okay.
Yeah. Thank you, Dr. Sharanya. It's a great privilege for me to organize this one-day national webinar on the eve of 10th Ayurveda Day. So, as you all know, the theme of this conference, Ayurveda for People and Planet. So, as the theme goes, we are concentrating on those areas where there is lacuna in Ayurveda management, related to ophthalmology. So there is little bit echo. We know that Shanta Kumari madam is a very renowned ophthalmologist. Since ages she is practicing the perfect Ayurveda blend of management of most of the ophthalmic disorders, and we are very much pleased and happy to have madam as our guest speaker for this national webinar. And madam was so kind enough to accept this offer in a just short span of time. And we were actually we wanted to call madam for our CME also, but because of madam's engagement, she was ready to participate in this webinar. And as you all know, the theme of this webinar is Ayurveda for People and Planet. So we are focusing on those diseases where there is lacuna. So we know that retinal diseases have a lacuna in modern times. There is no current treatment in ophthalmology, does not give that perfect effect or quality of treatment for the patients who keep on suffering. And Ayurveda has a lot more to offer. But unfortunately, we are not propagating this traditional knowledge to the general public. So, keeping this in mind, we have organized this webinar mainly to convey this information to our participants who are teachers in different institutions, and also students who have joined this session, so that we can. They also will become aware, and they are the ones who will aware the patients. So it is as I am in Jaipur, they are people have joined, teachers have joined from different parts of the country. Definitely this will help us in spreading this Ayurveda knowledge across the country through the media of different teachers who have assembled here, and in that way they can give that information to the patients for quality treatment which is available in Ayurveda. So, fortunately, at NIA, we are very lucky that we have very good patients who come across the country who are suffering from rare diseases and who can take treatment here. And we also show the treatment, effective treatment before and after. Also, we give them result. And in this way, we have a very good OPD at NIA, and especially patients suffering from different retinal diseases like ARMD, macular degeneration, and this NPDR, and retinitis pigmentosa, and Leber's hereditary optic atrophy. All those patients approach us for the availing this treatment. So in this way, we also give them a fruitful result, and in this way, Ayurveda has propagated, and we have a very good OPD of 80 to 100 patients. So in this series, we have focused this Ayurveda National 10th Ayurveda Day celebration. We are focusing on retinal diseases so that we can give some justification to those patients who are suffering from this disease. So in this way, I would like to welcome all the participants who have assembled for this webinar. Definitely, Madam has a vast experience, and Madam's knowledge will give valuable insight for you to practice ophthalmology, and definitely you will get a lot of take home points so that you can apply it on the patients, and at the same time spread this Ayurveda knowledge to the public, and in that way you can aware them that even though we don't give acute result, like we don't give them 100% result at in a short span of time, but definitely in a 2 to 3 months span, if they are continuously under Ayurvedic treatment, we can stop the modern medications to some extent on, or put them purely on Ayurveda treatment, which is greatly helpful. So thank you for being present for this webinar. Thank you. And I also extend my heartfelt thanks to Professor Shanta Kumari Madam, who has agreed to give us valuable inputs in this webinar. Thank you, Madam. Next.
Thank you, Shamsa ma'am.
Yes. Sharanya,
It is an honor to introduce our speaker, Professor Dr. P.K. Shantakumari ma'am. Dr. P.K. Shantakumari, she completed her PG in Shalakya Tantra in the year 1982. She has 32 years of working experience in Department of Shalakya Tantra in various Ayurveda colleges in Kerala. She retired as professor and HOD, Government Ayurveda College, Thiruvananthapuram. Ma'am has also published books entitled Textbook of Ophthalmology in Ayurveda, which is CCIM approved, and Netra Samrakshanam. Ma'am was also honored with first Atreya Award, which is instituted by Government of Kerala for the best doctor. Also, she is a Rashtriya Ayurveda Vidyapith Guru. Ma'am was also honored as Legend Shalaki by National Association of Shalaki. She is the founder, chief physician, and managing director of Mata Ayurveda Eye Hospitals, Kerala. Now, I welcome Professor Dr. Shantakumari ma'am for the session. The session is over to you, ma'am.
Madam, please unmute your mic. We are not able to hear you.
Good afternoon, everybody. And first of all, let me congratulate the Department of Salakya and the organizers to conduct such a good program in connection with the World Ayurveda Day by focusing on Salakya Tantra. Actually, this will give an exposure to Salakya, that is sure, and help the Salakya students and also practitioners. Nowadays, it is seen that the world is curiously and hopefully looking at Ayurveda for many unsolved clinical conditions to get a pure solution. So it is our responsibility and our, what I will say, really responsibility to update ourselves to the depth of Ayurveda so that we can help the need and hope of the society and the world. In the case of Shalakya Tantra, these degenerative conditions are still an unsolved problem. And the number of patients coming to Ayurveda in search of a perfect solution is increasing day by day. In our hospital also, the same situation. And Dr. Shansaj also told the number of patients searching for Ayurvedic solution for these ophthalmic conditions. I think it is more in degenerative conditions. In spite of all the researches and all the modern technologies, the number of these degenerative conditions are increasing, and not yet a pure solution is in our hands. That is the actual situation. Now, the doctor told me to speak something about the degenerative conditions of retina. Retina, different types of retinal conditions. And really, this everybody know what is retina and what is the regenerative conditions, everything. But still, we have to go to the depth on Ayurvedic principles before going for the treatments section. We know retina is the nervous layer. It is lying inside the eyeball, in the posteriormost part of the eyeball, and the light rays reflected from the object is getting converged on this part, and then, especially in the macular region, and then a series of reactions are taking place, including photochemical, then electrical, then nervous, everything, and an impulse is formed. This is transmitted or conducted to the brain, and this impulse is changed or it is performed to get a pure visual sense. This is the summary of vision. Then what is the role of retina in this? And when we say the retina, we know all points of retina is equally important. Still, I am selecting here for 4 different or separate structures for the present this topic. One is macula. The second is optic nerve head, from where the optic nerve starts. The next is retinal pigments, and fourth is blood vessels. Because these are involved in the degenerative condition or the degenerative pathology in a way or other. So we have to understand what are these points and what is its function and how is it get degenerated. And among these 4 structures, I am starting with the macula, because all those who are practicing eye disease can understand that the number of macular disorders, macular edema, and this macular degeneration, different types of macular degenerations, the number is increasing. And this is the greatest group of disorders which is affected in working group of people. That makes so much disturbance in the society. So it is the responsibility of the salaried specialist, especially those who are handling eye disease, to have a deep knowledge about these retinal disorders so that they can find a solution by themselves. And the number of people coming to my hospital, our hospital also is very high. And really I am happy to say we can offer satisfactory result to the macular degenerative conditions. Then what are the main features of macula? We know it is the most sensitive part of retina where light rays converge. These light rays are reflected from the objects. In this realm, when we say light rays, it is not a simple illumination or light. The rays reflected from the object is actually carrying along with it the details or the characteristic features of that object. That is the main point. Many people forget about it. It is not light. And the characteristic features of that object means its color, shape, size, and thickness, everything and everything, all features. That means these light rays are carrying these peculiarities along with it. And these light rays are focusing or converging on the retina. That means when it is converged on that point, actually what happens, that area is catching it. I will say grasp it. This is the first step. Indriyena indriyartham hi samanaskena grihyade. Here the light rays are received or accepted. The light rays means the peculiarities or the features of that object is accepted or grasped by these retinal cells, especially the macular region. Then what happens? This very special or very specialized tissues of this area is analyzing these features. Kalpade manasa turdam gunado doshado adava. What are the features? What are the peculiarities of that object? That is analyzed by these tissue cells. How? By a series of reactions. So finally, the result of these reactions or these particular actions or the working or functions of these cells or the macular area, the outcome is an impulse. In short, I will say this impulse means it is a very peculiar term and very important factor also. The external object, whether it is live or non-living, living or non-living thing, whatever it may be, that particular object has changed to a biological factor as an impulse by the special actions or functions of the retinal cells. That is what is happening there. That is how Grihyade, gunas and doshas of that particular object is analyzed and it is changed to a biological factor. Then it is easy to handle these things. Since it is an changed to a biological factor, the body can handle it, or the body tissues or the other structures can handle it easily. This very important step of the visual process of vision is started by this particular area of the retina. Then now, instead of this external object, we have got a biological factor, and that can be handled by the body tissues, biological human body. Then the first step is over. That is very important. Then we have to analyze this on the basis of Ayurveda. Then only we can find a solution. The functioning factor behind this method or this particular action is nothing but Pitta. Alojika Pitta. We know the factor that was in the eye is Alojika Pitta. Rupa Alojana Dristam Alojagam. It is analyzing Rupa Alojana. That is very important term is used. It is analyzing the object. That is why it is given the term Alojaka Pitta. So it is this Alojaka Pitta that is working inside the Drikstham. It is inside the eye or Indriya. The Indriyam we can say in general, and Indriyam and Indriya Avayavam is different. That is another fact. We are not going to that much depth. It will take much time. Anyway, it is in the Drishti or in the Indriya. Drikstham. So it is this Alojika Pitta that functions these things. And when we think of this Alojika Pitta, it has two fractions. One is Chachur Vaisheshika Alojika Pittam, which is mainly concerned with the functions that happens inside the eye. Second is Buddhi Vaisheshika Alojika Pittam, which functions beyond the eyeball. Of course, it is the Buddhi. That is why Buddhi Vaisheshika. That means once the impulse is formed by the Alojaka Pittam inside the eye, then it is transmitted to the Buddhi and it is converted from this impulse to the sense. Nischayatmika buddhi. That is the final confirmation. So we can now this is the macula. What happens in the macula means it is the functioning site of Alojaka Pittam, mainly Chachurvaisheshika Alojaka Pittam, and this is the place where the external object is converted to a biological impulse. And then thus it makes it easy to understand the features of that particular object. Grasping, that is macula. Then we can conclude to some points now. Macular degeneration, we can understand macular degeneration in a better way. In that case, in a macular degeneration, Alojaka Pitta will be vitiated and it affects macula. And so what happens? Macula is not able to function clearly. What is the function of macula? To analyze or to the features of this object and thus change it from the object to an impulse. That is the function of macula. That is not possible since Alojaka Pitta is vitiated and it is affected the macula. So in short, we can say it is not able to grasp the special or specific or characteristic features of that object. So what happens? The vision becomes defective. The defect in all sense. The color cannot be identified. There will not be sharpness. All areas of that object cannot be seen clearly. The distance may be changed. The near object may be seen sometimes far, or this distant object can be near visible as near. Like that, in all points, we can see the defect. What is the? Everybody know what are the signs and symptoms of macular degeneration. First is distorted vision. That means the actual size and shape of that object is not grasped by the retina. Since Alojaka Pitta is not doing its functions. That is why it gets distorted. The straight lines may be seen wavy or curved, or the boundaries or these limitations cannot be identified clearly. There will be scotomas or dark areas where it is not at all functioning. Mainly it may be in the central field because macula represents the central visual field, and sometimes missing areas in the visual field. There are some difference in the missing areas and scotoma. Scotoma is a dark area and missing areas where they are not able to see anything. It will be blank in other sense. We can say blank. Then in different ways of these floaters or flashes or flickering or so many things may happen. And even different types of other condition, signs and symptoms also may develop according to the age and the body nature and so many other factors. And in this aspect, I will say, kind of share with one of my experience with a patient. Just I think 16 year, not 16 now, she's 18. 18-year-old boy, well-built body, and having this macular dystrophy, high level. And the cornea, this macula was very thin and less than 200 only, 132, something like that only. And he was under treatment and gradually getting better. Then one day, then one course of treatment, after one course of treatment, the thickness was increased up to 230, something like that. Then one day I had a phone call, he was from Punjab. And there was a car, not an accident, was a very high level shake since it was jumping over a hump. Then immediately he was totally blackout. That means he was unable to see anything. He was highly, very much panic, afraid, and nothing was seen. And immediately he was coming to our hospital. By the time, little better. Then after treatment, the little betterment happened, and the central area became blank. Blank means not scotoma like dark, but invisible, blank area. Then the very particular symptom he told, if he is imagining any particular object, suppose a car, he will be seeing that image of car on that particular area. Can you say any explanation for that? Or if he is imagining any tree, he can see exactly the picture of that tree on that missing area, central blank area. You think of it and try to find out some explanation for that. After the session, we can discuss. Actually, if you are ready for a discussion, if there is a chance for that or a technique for that, I am ready for it. I think that will be more useful than the talk. And then
we can keep discussion.
Is it possible, Shansaji?
Yeah, in the end we will keep discussion.
Okay. Then now coming to the talk again, the main symptoms of macular degeneration we have already seen. Since allergic pitta is not able to function clearly, all that areas will be defective. No correct vision, no color sense, no this clarity, no this other 3D like visibility, everything become defective. Then on the basis of slight variations in the change, particular change, or that area affected, or the like this, the age and other conditions of that patient, there will be some variations in the signs and symptoms or clinical features. On that basis, I will say the classification is the different types of macular degeneration. The most common, most important thing, familiar thing is ARMD, age-related. That is very important. That is already macular degeneration itself, but it is induced by aging. We can't say it is not macular degeneration, but ARMD, age-related only, like that. Or macular dystrophy, where dystrophy is the main symptom. We can say macular dystrophy, but that also is a macular degenerative condition. Then cone dystrophy. We know macular area is packed with the cone pigments. If that particular structures are more involved in the pathology or in the degenerative process, that macular degeneration is can be called as cone dystrophy or cone degenerative condition. Then if rods also are involved, we can say rod cone dystrophy. And like that, we can say different, if that a particular bleeding blood vessels involvement also is there, and if it is genetic background also is there, then Stargardt disease, like that, we can classify it in different groups. But these are all macular degenerative conditions. And so I will say, since even though we are classifying it under different heads, there is a common thread connecting all this. So I will try to explain in that way. In spite of all these changes, differentiations, we can find out the common features among all these macular degenerative conditions. That will be easy for charting a line of treatment. Because I am always a practical person, and theories are well known to everybody. We'll get it from books or for net or from the theory is okay. There is no scarcity for theories in Ayurveda. But the only problem is the practical implementation. How can we implement these theories to practical aspects? That is very tough, really, really tough. So we had to find some solutions to this problem. I am, Doctor introduced, I was working in the academy for more than 30 years. So I have seen or well understood the uh, students' mentality, where they become fail or where they find difficulty. It is only in the practical section. Theoretically, they're very, very bright always. But because all these things are on subjective level, when we say flashes, what is flashes? Nobody can see a flash. We cannot measure it. We can understand whether that person is seeing flash or not. It is very tough. In the college days, I will say an example. Will be students are in the classroom with the well-opened eyes or well-opened ears and without any disturbance. The teacher is shouting something on the stage, but they are not hearing or they are not seeing the teacher. Why? Their eyes are good enough, but they are not seeing. That means it is subjective only. This and all this and subjective means they only experience it. That is the toughness when we handle the disease of sense organs. We can't believe whether they're seeing it or not, or whether it is they are experiencing it or not. Not even now, the devices to measure the pain is not perfect. To measure the intensity of flash, nothing at all, not at all. Or to find out whether he is seeing flashes or whether we can count the flash, nothing. Even we are using this Snellen's chart to measure vision. If he is reading, it is okay. Otherwise, we say, I can't read. The doctor will have to believe sometimes he can't read. That is the situation even now. Okay, this is our practical problem. So we have to find always some solution for the toughness of implementation of the theory. So that is why I'm saying, in spite of categorizing the disease to many, many things, we have to find some common features, some common thread, which can be found out in all these things. What are these things? Very simple. In all types of macular degenerations, the vitiated dosha is pitta, no doubt. We have to analyze it on the basis of Ayurvedic principle. Then only we can go for the treatment or management. In any type of macular degeneration, the vitiated dosha is pitta, mainly allergic pitta, secondly, buddhi-vaisheshika allergic pitta. Then the site of affection, that means sthanam, sthana samsara, that is the same area, macula, no doubt. Then what else? The dhadus involved. Anyway, Rakta and Rasa is there. If there is involvement of other dhadus also, it is there anyway, otherwise vision cannot be affected. The fraction or the proportional variation may be there, but still we have to consider Rakta and Rasa. Then comes Madas also as the involved dhadus. Then comes the pathological change. It is dhatu trayam. There is a dhatu trayam. And which dhatu, that varies. Anyway, these things are there. So if there is some common features behind all these types of degenerative condition, whether it is Stargardt disease or whether it is ARMD or macular dystrophy or cone dystrophy, Some common features are there. So first of all, we can make a common line of treatment. I am not going to the theoretical aspect too much. If we have to handle a case, we can adapt these steps. So we can find out the common things that is very clear, and allergic pitta is there, Rekta dhadu and other supporting dhadus are there, Sthana samshrayam is the same, and the pathological, the samprapti, in the stage of samprapti, it is dhadushaya. So these are common. So we can make a common line of treatment also for these things, which will be very helpful while handling the cases. How is it? Now coming to the treatment side or management side. I will always make 4 steps in the treatment. First is always selection of drugs. That is the first step of the treatment. Which all drugs should be used in that condition? And second is mode of preparation, that is Aushadha Kalpana. How these medicines are to be prepared for is applying in that particular condition. That is selection of Aushadha Kalpana. There are, in Ayurveda, the drug is important. So with the Kalpanas also. Whether Gruda Kalpana, Taila Kalpana, or Kashaya, or Gudiga, how it is to be prepared. That is equally important. Then comes Kriya Kalpana. We have already made some Gruda, or we have already made some Taila, or some Kashaya. How is it be applied, administrated to that particular patient? That is Kriya Kalpana. Then in Ayurveda, in the same way, the drug selection and the Kriya Kalpam also equally important. It is specially modified mode of applications. In the disease of retina, which Kalpana will be best? And in a disease of cornea, which will be the most favorable or most result giving mode of application. Like that, the third step is selection of Kriya Kalpa. Which type of administration should be used? Then I am adding one more step, assessment and follow. Without assessing our result, we cannot go forward. Many students are failing in that test. Once we are getting result, completing the treatment, they think everything is over. There starts the treatment. Because in the introducing section, Dr. Shansai told that we will not get the result immediately. That is a truth. Because this, if it is a degenerative condition, and if we are not going to surgical intervention, then the result will be slow. We have to make that particular structure or bring back to normal in its good working condition. It will take time. If it is doing some surgical procedures, it is okay. To cut it, it will go. Or to add something, to implement something, that's okay. But here it is not like that. It will take time. So assessment of the treatment and follow up. These are very, very important factors. So we have to go through these 4 steps while handling especially a degenerative type of disease. Here I am focusing on the macular degeneration. So let us go to the first step, that is selection of drugs. Since we have already find out some common features in all types of macular degeneration, we can conclude in this section also what types of drugs are to be selected. No doubt with the seminar. Isn't it? In all these varieties of macular degeneration, Pitta is the predominant dosha or the vitiated dosha. Then the drug we are selected should be Pitta Shamana. And the site of affection also is same in all these terms. whether it is different, even though it is a dystrophy or degeneration or cone dystrophy, whatever it may be, the site is same. That is, so all the drugs we select should be Chakshusya in its nature. That is the second criteria. What all criteria should be fulfilled for the selection of drug? That is our point now. First of all, it should be Pitta Shamana. Second, it should be Chakshusya. It should, what is Chakshusya? It doesn't mean that it should give good results. The drugs which acts in the ocular tissues or in the ophthalmic tissues can be termed as Chakshusya. In generally, we can say in a good way, better way, in Pathya way. So all the drugs we select should be Pitta Shamana and Chakshusya. Then comes to the pathology, that it is degeneration or there is a Dhatushaya there. So it should have Rasayana property. So generally we can say the drugs we select in the management of macular degeneration should have whatever types of macular degeneration it may be. It should be Pitta Shamana, it should be Chakshusya, it should have Rasayana properties. Then some more points are to be considered, that is as per the general rule. This Dashvida, Sanasa, Dushin, Desham, Belang, Kalam, Manilam, Prakriti, Vayasat. On that basis, we can have the selection points still. But these should be there in all the drugs we select. It should be Pitta Shamana, it should be Chakshusya, it should be Rasayana, no doubt. Now we can have some selected drugs for the management of this, which are Pitta Shamana and Chakshusya and Rasayana. So so many names will come to our minds. Draksha, Ushira, Amla, Chandana, Bidayadi, Jivandi, Jivaniyagana, Kavoli. Like that, you can see the Grudam as the medium. So all these names are coming to your minds, isn't it? So it is coming, it is becoming symbol. We have got so many common features. We have got some drugs. Then how to prepare it for the management of this macular degeneration? That is the next step. Mode of preparation. Choice of Aushadha Kalpana. That depends upon the Kriya Kalpana. For what purpose we are preparing, it should be suitable for that. For example, if you are making this medicine for Tarpanam, which preparation will be suitable for that particular patient? In most cases, it will be Kritakalpana, especially in the retinal degeneration, because we have already seen that it is Pitta predominant. So the best medium for Pitta is nothing but Kritam. It is suitable, it is also Chakshusya, it is also Rasayana, it is also Pitta Shamana. Then the best medium will be Kritakalpana. So using the selected drugs, we can make a Gridam. And how to apply? If it is for Tarpanam, Gritakalpana. If it is for Segam, we can make a Kashaya Kalpana. Siddha Kashaya, Panda Kashaya, whatever it may be, according to the condition of that patient and that clinical stage. So that is the next criteria, this preparation. Then comes mode of application. Suppose we have already selected some drugs and have prepared some drugs, then these two comes together. How to prepare, how to apply. So then we can use this prepared medicine in a better way. I think you are following me. Is it?
Yes, ma'am. Yes, ma'am.
Okay. Then I am only talking a very practical way, because I believe you are all well educated and they are well. You have very good knowledge about the theory. since all are mainly most of the audience are PG students or teachers, I think. I believe like that. So on this line, we can schedule the treatment. First, we select some drugs. We need not depend on some preparations which is available in the market. That will always become a failure. Only few preparations we will get. Till the day there is no two people alike in the world. In the same way, if there is no two people alike, there is no two disease alike. So many small variations will be necessary in our preparation or in the mode of application also. So if you are following this line, first select the drug and then select the mode of preparation, then select mode of application and use in the correct time. There are so many other criteria and to be satisfied. And if you are following this, we will get a good result. And then what about how we will make changes in this line according to the different types of degenerations? It is very easy. Just analyze it on the basis of Ayurveda theory only. For example, if we are considering a case of cone dystrophy, that is very similar to that of macular degeneration or these other types of macular disorder itself. But what is the difference? The particular pigment cone is more involved in the degenerative change. Then we have to think what is the particular property or function of this cone pigments. It is nothing but the daylight functioning, photopic vision. So in such a case, the functioning of the cones is defective and so photopic vision will be defective. More seriously it will be the symptom. There will be hypersensitivity to bright light and photophobia like symptoms or unable to face the light source, not able to drive in the night, especially to see these headlights of the vehicles, like that. These will be the main symptoms. Then what is the change to be considered in all these above three steps in the selection and in the preparation, like that? We can simply say if it is more with the light sensitivity, then what should be the particular point to be considered? Should be Pitta Shamana, Chatusha, Rasayana, and Shida Gunam. Then comes Tushira, Chandana, etc. Comes to the picture, it comes to the top. These are Pitta Shamana, Amla is Shida in its property, and also Chatusha, also Rasayana, and also Pitta Shamana. Then that becomes a choice. So with the Chandana, that is with the Samana, Shida, and also the Saina. It was in the ophthalmic tissues also. So we can select like that. Like that, if we are going through the literature or going through the Dravyas, we can select drugs which are suitable for that. And about the medium, Grida is in a way Vada Pitta Shamana. Here we have to select a better medium. What is it? What about milk? What about tender coconut water? Or what about simple Fandakashaya? We can consider all these things. Like that, keeping all these basic criteria satisfactorily satisfied, we can add something more properties to the Dravya selected. Got it. That's very important. If we go through that line, it is very easy to find a solution. So this is an example. If the macular degeneration is more involved in the the degeneration of cones. We need not go for a special treatment for cone dystrophy or cone degeneration. We can keep the same line of treatment and make a necessary fine tuning also only is necessary. Like this, instead of one in something, some one yoga or one combination, we can use little more suitable to that. That's all. But it should satisfy with the basic criteria. Keeping it in mind, make fine tunings. That is my advice. Like this, instead of, but in the suppose the macular dystrophy, another condition, that also is a type of degenerative change in the macular area. But what is the difference between cone dystrophy and macular dystrophy? If in the cone dystrophy that particular pigment is more involved, in other side it is more the structural or the tissue is dissolved or more degenerated. So in that case, Vada comes to the picture. So we can think of the fact that if it is Vada is the associated thing and that also is more involved in the pathology, then what should be the additional factor to be considered? It should be Pitta Shamana, it should be Chakshusha, it should be Rasayana, that should be satisfied anyway. Additionally, it should be also Vada Shamana. It should be in a way little Brahmana also, since Dhadushaya will be more prominent there. So instead of this Chandana or Ushira or Amila, we can select something else. What about Jivanti? What about Vidari? These are all Vada, Pitta, Shamana, Chakshusha, Rasayana, and also little Brahmana. Simple. So a little knowledge about the Chakshusha drugs. We can have a large number of Chakshusha drugs in our in our mind. So the only responsibility is to select from pick up something from here, something from there, like that. Then our job is finished. So if it is a general dystrophy or more shrinking type changes in any type of this macular degeneration, we can select that type of things, keeping the basic elements as such. Add some additional properties to the so here instead of this Gridam is a very good choice for Kalpana because it is Vada Pitta Shamana. Grida is always Vada Pitta Shamana. It is Chatushya, it is Brahmana in nature also, Dhadu Vardhana. So that becomes a choice. That can be used in different ways. Then we will get the maximum results. Like that, keeping the basic factors satisfied, we can add extra properties or extra points so that we will get more and more results. That is the inner point for success. I had tried even this vegetable soup or even the soup with meat, with the head of goat also. We can add which is necessary. Only thing is we have to keep the basic things satisfied. Additionally, we can use anything, not anything which is suitable. According to that, for a small boy, what should be done? Nowadays, these macular degenerations are coming to young children. I have seen a boy with 3 years now, an 8-year-old boy, and 6 year, 10 years, like that. Previously, in my starting time, it was an age-related problem only. This type of affection in the young age is very less only. Now that is not the situation. So add-on treatment will be necessary now. Add-on treatment means add-on properties to the drugs or to the treatment procedures that will give added result also. So like this, we can handled macular degeneration cases in a very successful way, no doubt. If there is an again in the road, it is not coming to the macular. Actually, it is beyond the macular area. The spread of roads, the peripheral vision will be more affected, and instead of this photopic vision will be affected. Then the picture changes. Don't do the same things in all conditions. Since it is retinal degeneration, we can do the same darpana. No, no. It is not like that. We have to analyze it on the basis of this predominant dosha and the site of affection. The situation will change immediately in my forecast. Immediately, instead of Salak specialist, now we have changed already to eye specialist and ENT specialist and dentist. Immediately, we change it to still specialties, retina specialist and this lens specialist. Like that, we will move. It should move. Then only success rate will be increased. So this is the case with the macular degeneration and its management. I think I have summarized it in a nutshell on the Ayurvedic basis. Is it okay?
Yes, yes,
Yes.
Then how much time?
you can continue,
You
madam.
can continue, madam.
Okay, like that, any disease of the retina we can handle like this. This is about macular area, and if we are taking the other area like that, the second step may be this instead of macula, if we are taking optic nerve head, there the picture is little more different. This optic nerve head is only the point in the retina. Hmm?
We can do that.
Yes, I'm not hearing it. Little. Hello.
Ma'am, you can continue,
You can continue, ma'am.
Okay, I think something was hearing in between. I didn't understand what is it. Okay, if you're going to optic nerve, even though it is not uh, in a literary way connected with the retina, but we have to start the optic nerve from retina only. Hmm? Then that is why I'm saying optic nerve head only. Then what is the importance of this area in the degenerative condition of retina? We have already seen that once the impulse is formed in the retina, it is to be reached until this optic center in the brain or to the buddhi kendra. This starts from the optic nerve head from the retina. So once, if there is any problem there, maybe different types of pathological changes are there, maybe inflammatory or this fluid accumulation, papilledema, optic neuritis or optic atrophy, like that. So many conditions are there. If there is any defect on this entrance of this optic nerve, then what will happen? The impulse formed on the retina or the object which is grasped or changed to the human tissue level, it is not getting conducted to get a confirmation. What happens in the brain or in the buddhi, or what is the function of buddhi vaisheshika alojaka pittam? It is starting from chashru vaisheshika alojaka pittam in the eye. It is to be confirmed at this buddhi by buddhi vaisheshika alojaka pittam. So it will not be conducted even if the problem is in the entrance of that nerve pathway or that doorway. It will be obstructed. It will not go forward. So that is the problem with that. So if butter may be the basic pathology, whether it is inflammatory or enzymatic, and when it reaches the degenerative stage or neuropathy or optic neuropathy or optic atrophy like that, then in that stage we have to consider the involvement of vata also. Then in the same way we can chart out a line of treatment selecting these same steps. Here, the predominant dosha, instead of pitta, we can say it is vata. And what is the function there? Conduction, chalana. It is leading or conducting from one point to another point. That will be arrested. Then, what will be the pathological condition? No doubt it is degeneration. The other time is still there. The sthana samsram in the drishti is drishti only. So on that basis, we have to do all the other selections. What should be the, I have already done 4 steps. First is drug of choice. That means selection of drugs. Here we have to say it should be Vata Samana, Chakshushya, Rasayana. These are the main features to be fulfilled while handling a case of optic atrophy. Then what is to be done? The sthana samsram is not only in the eyeball, but mainly it will be in the pathway beyond the eyeball. So the sthana samsram we cannot say inside the eye, but in the cirrus, beyond the eyeball. So the treatment should not be focused in the eye. Just like Asodhana Vedana, that can be used as supportive, but it should be focused on the head. Then comes the Vada is a predominant dosha, and the site to be focused is Shiras. And then what all changes should be done? The drug should be Vada Samana, Chakshushya, and Rasayana. Then mode of preparation, the treatment is to be done on the Shiras. So what kalpana will be used and what preparation should be there. If this treatment is to be done on the head, for the samana or for the treatment of vada kopa, then taila preparation comes to the first. So we have to prepare taila kalpana to do more the taila kriya kalpam with the vada samana and chatusha and rasayana drugs. So the same line of treatment, these selections and steps we can use in all types of degenerative conditions. Then our approach and our managing will be simple and easy. That is why I am describing like this. Otherwise, we had to select one drug and there's so many steps of treatment and medicines like that. It will go. We have to simplify it, so that we can modify it at any time. So if yes, for a degenerative condition where vada is involved and optic nerve is site, and the medicine is to be applied on the head, we have to select some vada samana and chakshushya. And since it is working more on the head than the buddhi, some additional properties we can take for this special vada samana. That then here some what will say something which will increase buddhi, meda, like that. Then accordingly we can select the drugs. Brahmi will come to the in Jyotishmati can be selected. These are all chakshushya also. It will improve the function of buddhi also. These are rasayana also. We can prepare taila kalpana with this, and we can do different types of murta taila prayogas. Then the treatment is simplified. Then according to this, I am this age of the patient or the intensity of the case or the place they live and the age and so many other factors, just like Dushan Desham, Belam, Kalam, Manilam, Pragdivaya, Sattvam, something like that. We can add something else and we can change the things and modify. Like that, we can make a treatment line of treatment for all special conditions. That is my approach, and I have got very good results in when and easy and will be self-confident, Atma Vishwasam, I will say, while handling such a case. Because anyway it is Vada. I have selected Vada Samna, and there is Dadushaya. I have selected Rasayana. Then in that way we will have a self-confidence, which is very important while handling a disease, especially that of vision. Because now anyway people will be very very sensitive in their vision, not like just as edema on the hand, this leg or a pain on the hand. It is not like that. The mental status of a visually defected patient, they are very sensitive and delicate also. And I have seen most of the patients, when we see they'll be physically fit and having that much height and weight, but then start to cry just like a child when they start to describe their vision problems. That means that much is sensitive. So a self-confidence by handling them, it is very, very important. Otherwise, the patient cannot believe or be happy or satisfied with the doctor. Only if we, those who are handling the cases, have to be confident, self-confident. Then only the patient will get the results. Keep it in mind always while handling a case. Then that is the optic nerve condition. Then another important field is the blood vessels. Blood vessels, when we are coming to please 1 minute, let me make a little. Actually, when we come to the blood vessels, it is a very vast topic. There comes the complications of systemic disease also. Just like anyway, most of the systemic disease, especially diabetes and hypertension, is affecting the microvascular system of retina. So the time, it will not end within 1 hour, 2 hour, anything like that. So I will just to say it in a nutshell. Even though it is Pitta and Vata dominant, the retina, when we say blood vessels, it is not simply blood, but it's a Rakta Dhatu, the nourishing factor of the retina, and keeping the intact nature of the retina. These are all done by the blood vessels. And then comes another point also, the aqueous humor, which is coming from the blood, filtered from the blood. That also turns to be a very, very important point. in the degeneration of the retina also, indirectly. So now I am not going to that much depth, but the blood vessels, in short, that's are two types of circulation or blood vessels. One is main central retinal artery and vein, that is coming through the along with the optic canal and coming to the retina and spreads. The second is from the choroid. These are anatomical features everybody know. So when there is these main things now seen is mainly uveitis, even though it is an inflammatory condition of the uveal tract, it affects retina in a secondary. And the symptoms are highly varied. The now the ophthalmic doctors are really failing in handling a serious type of uveitis. Even with the steroids and even with the immunosuppressants, the result is very, very low. But in Ayurveda, we can handle because we have a very, in the other way, the same pattern we can take. What is the this predominant dosha here? Pitta and Kapha. In all the disease of blood vessels, there will be involvement of Pitta, but if it is an inflammatory, there will be involvement of Kapha also. So while handling the blood disorders, we have to consider these predominant doshas as Pitta and Kapha. Then what is the site of affection? It is vascular area. But in macula it is avascular, but here it is vascular area. There already Pitta dominance is there. Vascular area. And what is the vitiated dhatu? It is Rekta. In other case, it was dhatu chayam, but here there is no dhatu chayam, but different types of blood disorders, mainly inflammatory. So here we have to consider Pitta and Kapha as the dominant doshas, and the Rekta mainly and associated with other things, mainly Rasa, as the affected dhatus. And the site of affection, this circulated or circulatory areas, and then what is the pathological change? I will say Abhishinda. Abhishinda is a condition where I mean now there are different opinions about Abhishinda and the long-standing arguments are there that I know. It was there when I was studying. From the very beginning, whether it's a conjunctivitis or it is a general condition or the starting of this glaucoma, there are like that so many things are there. That is why I always want to be practical and see what is the common features, what is the involved structure, what is the dominant dosha. Like that, if you're thinking, then solution will be easy. Then being arguments here and there. Here, Abhishinda, anyway, there is a sendatam. Sarva orda jatra sroda sendana senda. So, that is, there is a sendatum. In any sendatum, there will be involvement of Kapha and Pitta. That is why it is said that Prayana sarve nayanamayastu bhavandi abhishanda nimittam. What does it mean? It is not a particular disease. Even before that, there will be an abhishanda. That is okay, just an interest only saying. But in the case of the disorders of blood, we have to think of some congestion of the vessels and blockages to the vessels and bleeding, and without bleeding, leakages. These are the things we have to consider. First is the congestion, where blood is not leaking, not bleeding, but there will be congestion. That is the first step. Then starts blockage. Blockage mainly by deposits. maybe either by this vessel walls, deposit on the vessel walls, or something as an extra foreign body. Mainly deposits are the main reason. And then what happens? Leakages or blockages. Then as a result, new vessels starts, neovascularization. These are the, then as a result of these leakages, there will be accumulation of fluid, retinal edema or retinal hemorrhages. In severe cases, vitreous hemorrhage, and then it goes to clots. Then there are different stages. The treatment in all these stages are different. The treatment which is in a bleeding stage cannot be used in the treatment of clots to drain out the clots. It is entirely opposite. That is why the stages are important. But here also we can take some common threads. All are having pitta dominance. All are in the vascular area of the eye. All are having the dominance of dhatu rekta. If so, we can have some common features. How should be the drug? It should be pitta shamana. It should be rekta prasadana. It should be chatusya. Then also it should be abhishandahara. These are the common features. It should not increase the pathology of abhishanda in any way. It should be acting on the rekta dhatu. It should have some pitta shamana property. Instead of in the degenerative conditions, I told it dhatu chaya and it should be rasayana. Here instead it should be pitta shamana and rekta prasadana and also abhishandahara. Then we can enumerate so many drugs on that. Then it comes this Tribala, Darvi, Yeshti, Lodram. Like that, so many drugs will come to the list. Then if there is blockage, it should be in particular way that will drain out, or it will be like this flow should be maintained. That type of drug we have to use. If there is bleeding, it should be rekta stambhana, never in the other way. If there is congestion, it should be abhishandahara. It should not be healing type. Like that, according to the particular condition, we can add on properties for the drugs we are selecting. But a common feature should be considered always. That should be pitta shamana, chatusya, and acting on the rekta dhatu. These are common. And abhishandahara, these properties are common. But whether it is rekta stambhana or rekta shodhana, or abhishandahara or this robana, these are another things, additional things we have to consider. Accordingly, we can take some additional properties to the drugs. If it is bleeding stage, we can take Latcha, Lodra, etc. These are Rekta Stambhana and Chatusya. If there is more Abhishanda thing, pathology, we can add Robana. Then comes Darvi, Yeshti, etc. Like that, we can add special properties while selecting the drugs. Then comes the next stage. Mode of this Aushadha Kalpa, mode of preparation of the medicine. It should be suitable for Pitta. Then comes mainly, here blood is the thing, and the properties will be Sara, Drava, like that. Pitta is always having two different types of properties. Pitta Sasneha, Teshna, Ushna, Legu, Visra, Sara, Drava, the properties. Then Ushna, Teshna, Legu, these are one group. Snikta, Sara, Drava, these are another group. If this Snikta Saradrava are the vitiated gunas, then Kaba will be coming in as an associated dosha. If Laghu, Teshna, Ushna are vitiated, then Vada will be coming as an associated dosha. So when we take Pitta into consideration, we have to see which property. In the case of this blood diseases or this type of abhishandas or blood vessel related disease, we have to think of Saradrava properties of Pitta. So that type, so the drugs also should be selected accordingly. That we have already selected. Then what type of application? Accordingly, what type of preparation? Then I will say the suitable mode of preparation will be always kashaya. Different types of kashaya to be applied on the head and not taila. It is better either kashaya or Shira Kashaya, Shira Pagam, or normal. Different types of Takradhara or Shira Dhara or simple Kashaya Dhara. These are good in that conditions. So, what type of preparations? Kashaya. What type of application? Dhara. In the eye also, Sega, Vidalaga, Asodhana like that. So if you are analyzing the condition on the basis of dosha, dhatu, dasrasthana, and the pathological change, you have to select the drugs and then select the mode of preparation, then select mode of application, then you will get the result. You can analyze any disease on this basis. So next, if we have to go, it will be individual disease by disease. That will be very vast, I think. So if we have to discuss about these things, we can start now. Otherwise, we will not get time.
Okay, ma'am. That is an enlightening session.
1 minute, Prabi.
Ma'am.
All of you have got a vast knowledge regarding the diseases. So I think all of you have got the basic idea, like how you have to select the drugs. So what should be the property when you are selecting the drug? So as Madam has highlighted that it should be having chakshusha dravyas, and all of us as Shalakis, we should also have a knowledge of different types of chakshusha dravyas. And whenever we are treating the patient, we should have this dosha vivechana in mind. So the taratama bhava is very, very important. Which dosha is vitiated to maximum extent and which is vitiated to a milder form. So we have to treat the predominant dosha first, followed by the less predominant. And as Madam has highlighted that how the retinal, the part which is connected to the optic nerve head, here we have to consider vata as the cause, and here vatahara dravyas, neurogenic medicines have to be implemented at this stage, and we have to select those drugs which are also chakshusha and also having this neurogenic effect like this. And here we have to consider pitta also, pitta and vatahara. So ashwagandha, then vidari, all these drugs can also be used here. And treatment also should be focused on the sthana, that is the shiras, when we are treating the optic nerve head disorders. So here the drugs also should be having vata shamna, chakshusha, as well as rasayana action. And Madam also said that the kalpana which we have to select is the taila. So this taila gets better absorbed in the head, and especially murdha taila we have to select for the degenerative conditions, as Madam has pointed that buddhi and medha have to be highlighted. Like we have to use those drugs which are potent in this increasing the buddhi and the medha. So jyotishmati and brahmi can be added to the medicine list. And also, as Madam has clearly highlighted that in case of degenerative changes, Rakta is the main dosha, because there will be a state of hypoxia which is created. So that is why, because of this hypoxia, the other changes take place. So nourishing of retina is very, very important. And here, Madam has also highlighted one more thing, that for aqueous humor also, it is also product of blood. So here we have to think at that level also. And this pitta and kafahara chikitsa will be ideal for treating all vascular disorders associated conditions in retina. And when we are treating, we have to also involve the vitiated dhatu, that is the rakta. So in this way, the circulatory areas, wherever the blood is circulating, all those areas have to be controlled. And main target here, we have to think about the pathological changes is about the abhishyanda, as this abhishyanda gives rise to syandana or some kind of discharge. So it may be at any level. So that is why we have to, this abhishyanda will give rise to mainly bleeding. So again, there will be a state of hypoxia, because it will give rise to this retinal tissues will not be properly nourished. And also, because of this bleeding, there will be leakages, then blockages, etc. And this will give rise to a state of foreign body in that area, and that will again gives rise to extra blockages, giving rise to this formation of fragile vessels in the form of neovascularization, and also collection of fluid, then vitreous hemorrhage, clots. So in this way, all this pathological events takes place. So that is why, whenever we are treating here, Rakta Prasadana Chikitsa as well as Chakshushara Chikitsa as well as Abhishyandahara Chikitsa has to be adopted. And whenever we are selecting the drugs, it should have Pitta Shamana properties. So Madam has highlighted a few drugs like Trifaladar, VST, Lodra, etc. And whenever there is bleeding, so Rakta Stambhana dravyas like Laksha, that have Laksha and other medicines like Lodra can also be included. And whenever there is congestion in any form, then we have to again think about Abhishyandara Chikitsa and the form of Ropana, etc. Dravyas having Ropana effect. So in this way, we have to select Pittahara and Rakta Prasadaka Dravyas. And Madam also highlighted one more point, that is when we are treating Pitta involvement, if it is with Vata, then the treatment is different. And if it is with Kapha, then it should be Tikta Sara Dravyas. If it is with Vata, Ushna, Tikshna, and Laghu Dravyas. So in this way, we have to again think. And whenever we are thinking of the dravya, the form of formulation, it should be kashaya based. That will give better result. And when we are treating for the head also, like dhara will be better. So kashaya dhara we can go, or we can go for takra dhara. And the same medicine, it should be aqueous based when we are looking into using the formulations for the kriya kalpa, like for aschotan and sek. You can start with the aqueous based medicines, what we are using in the form of Quath. So those medicines will be ideal. So in this way, Madam has given a thorough elaboration of how we have to adopt the treatment principles, which is very important because students and other staff, they will usually be confused, like what type of line of treatment we have to adopt, what are the pathological changes, and how we have to focus our line of treatment. So really, Madam has given a vast explanation about all this. And if you any of the participants have some doubts, you can definitely put up your questions so that Madam will be able to answer. So it was a very enlightening session, Madam. Thank you very much for that. So now it is open for the discussion. So any participants, if you have any doubts, you can just ask the questions. You can unmute and ask, or we can just see if you can put it in the messages, so we can explain. Pravi, can you see any messages are there in the box? You can ask the questions. Again, Madam will answer to that.
Ma'am, there is a query in the chat box.
Yes.
What are all the retinal disorders that we can handle and which all to refer?
Yeah, Madam.
With several retinal disorders means it will be a large, very deep question. And if you're confident enough to handle, we can handle. Otherwise, don't go for an experiment. That is my first advice. Anything can be handled. Total blind for a long time, it will be very difficult. I will ask them to stop the treatment there. After glaucoma patients having blind for last 5 years, 6 years, like that, it's very difficult to then make the people, to convince the people about the prognosis is more important. Whether to refer or not is the second line. Anyway, so many diseases are yapia in its prognosis. We know. And that type of people are coming to us. So we have to convince them what we can give them, what will be the prognosis, what they can expect. If they are convinced on that, we can handle any case. If you are not able to handle, if it is purely surgical, leave it off. If you are not able to
Sharanya, are there more questions? अच्छा, यहाँ आ जाइए। Madam, can you hear the question? Shanta Kumari, madam. Please repeat the question. Means just control the IOP when the all the retina is normal and optic nerve changes have not occurred. How we can control the IOP with Ayurvedic medicine? Is that the question? Any other question? Okay, Prabhi, you can start the vote of thanks. Thank you all for this. Like we have to thank Madam for giving us so much time to and clarifying all our doubts. So now I call Sharanya for proposing the vote of thanks. I would like to extend heartfelt thanks to Kumari Madam for giving us so much time, and also I thank all the participants who have assembled here. And I hope all of you have got brief knowledge about how you have to practice in case of retinal degenerative disorders. We will definitely have more fruitful sessions from Madam in future time. And we are also very happy to have you. Yes, sure, sure. Definitely. Yes. Thank you so much. Okay, this session, we close the session. Thank you. Bye. Thank you, madam. Bye. So all the participants, please fill the Google form. If you, we will give a e-certificate to those who have participated. Mhm. Okay. Okay. Thank you, madam. Okay. Take it. ये इसको हेमंत ये अभी तक हुआ नहीं था हाँ बंद कर दो ये रिकॉर्ड हुआ है क्या सेव कर सकते हैं ना उसको सेव कर दो